let's go straight to the opposition leader, Anthony Albanese. Anthony Albanese, welcome to the program. Thanks for joining us.
Good
morning,
I
ask you first about the new ad that's been launched today? What do you make of it?
Well, we've been saying for some time there needed to be a public information campaign, but I'm not sure that this cuts it, frankly. It's going to be very difficult for Sean McAuliffe to be able to send this ad up. What we need is actually taking the expertise that Australia has always done so well. We were the best in the world at the campaign against AIDS. We've done drink driving very well. But after 18 months, if this is the best they can do, I think they need to go back to the drawing board.
Any suggestions for the ad makers?
Look, I think my opponent is the advertising guy, but this is a government that spent $1 billion advertising itself, telling Australians how good it is. Maybe they should translate some of that advertising into this.
Let's talk more about the vaccine rollout. You've been very critical, of course, of the government for not having more supply in Australia and in place earlier. What, though, can be done now to boost supply?
Well, we need to aggressively increase supply. We need to talk to our friends in the United States about Pfizer and Moderna. Canada and Mexico have been able to get additional vaccines. We need to be moving with producing mRNA vaccines right here as well. The key is the supply of the vaccine. That's at the heart of the problem here. Scott Morrison had 2 jobs this year: to roll out the vaccine effectively and to set up national quarantine, and both of them have been botched, which is why we find ourselves now in this predicament.
The issue of trying to get more supply, though, now, I mean, you reference some of the countries that are getting surplus supply from the Biden administration, Canada and Mexico. There are a bunch of others. I mean, the issue is all of them do have far more COVID cases and deaths than we have in Australia. Canada, more than 500 cases a day, an average of 13 deaths a day. Is it feasible for Australia to jump the queue ahead of these other countries?
Well, it's a matter of getting access to more supply sooner. And we need to do that. We saw recently South Korea get access to the excess Pfizer vaccines from Israel. Now
we're friends they're getting about 1,000 cases a day
and the United States.
In South Korea, they're getting about 1,000 cases a day. I mean, is the issue here that we're a bit of a victim of our own success? There's more COVID cases and deaths nearly everywhere than Australia.
David, if you fail to plan, you're planning to fail, and that's what's happened here. We didn't do enough deals with enough pharmaceutical companies to get enough vaccines soon enough. The government was too busy out there advertising itself, saying we're at the front of the queue. We're last in the developed world for the rollout of the vaccine, and we're not in the top 100 of countries.
Yeah, I understand that point about what should have happened previously, but now, is it possible to get more now?
Well, other countries have been able to do so. And we also should be advancing on producing mRNA vaccines here. We've been arguing this, David, since last year. Had the government moved, we'd be producing them potentially right now. We've been arguing for some time there needed to be a 4-point plan: effective rollout of the vaccine, national quarantine, an effective public information campaign, and manufacture mRNA vaccines here. The government's been complacent, and that complacency has led to incompetence when it comes to the dealing with the challenge which is there. We've been constructive and put forward these ideas in good faith. The government has resisted them at every turn and has been too busy saying how well they've been going, advertising. They've spent a lot of money advertising how well the recovery is. But haven't spent anything on advertising the vaccine rollout.
The UK has about 65% of its population now fully vaccinated, yet they still have about 29 COVID-related deaths. That was just yesterday. What are your thoughts when we do get further down the track, if we do get to 65% of our population vaccinated? Do you think we're still going to need lockdowns, or do we follow the path of the UK and open things up and allow a level of COVID and even deaths in the community?
Well, it's unfortunate that the government only last week has asked the Doherty Institute to analyse what level of vaccinations we'll need before they then ask Treasury about the opening up of the economy. Quite clearly, what we need to do is to make sure that we maximise the vaccination of the public. The key has been supply. People in my electorate are desperate to get vaccinated. They log on to the system, they get given a number, and then they get told there's no appointments available at this time. And the reason has been because there simply haven't been the vaccines. I was in Gladstone this week, whereby you had just 8 vials of Pfizer vaccine at a clinic there at Port Curtis. That would be able to vaccinate 1,000 people a week if they only had the vaccines.
Yeah, and undeniably there's a lot of frustration out there. I guess my question is going to what level of vaccination does the population need to be at to avoid lockdowns, in your view?
Well, I think my view and the view of politicians when it comes to health advice shouldn't matter, David. We should listen to the health advice. The health experts say it's in the order of 80%, but we shouldn't preempt that, and politicians shouldn't be making those decisions in the absence of health advice. I think part of the problem here is that we have multiple sources of information out in the community which are contradictory over AstraZeneca, for example, and I think it's a good idea to leave the health advice to the health experts. Yeah. I don't have doctor at the front of my name, and I'll leave it to the doctors to give that advice.
Fair enough, but presumably the advice will say, here's the risk if you have 70% or 80% vaccinated, here's the risk that you have to be willing to accept. In your view, do you think Australia has a different risk appetite to other countries when it comes to COVID and COVID deaths? Do you think at some point Australia should be willing to accept some level of COVID in the community and COVID deaths in the community?
I don't think that ever we should say we accept deaths, David. And it's also my very strong view that we shouldn't deal with hypotheticals. This is about the science. And we should, as in other areas, listen to the science, the medical experts, those with doctors in front of their name who've studied this for a long period of time, as the people who we should be listening to.
But there's nothing hypothetical about what's happening in the UK, the US, all these other countries who are well down the path of vaccinations. I guess, are you saying we should not accept any COVID deaths at any point?
I'm saying that it's unfortunate that the government only initiated the Doherty Institute to look at these matters in the last week. We're 18 months into this pandemic. And I've been very careful, David, throughout this pandemic to not second-guess health advice, to not try and preempt health advice, but to listen to health advice and to convey that to the public. And I think it would be a good idea if all public office holders did the same thing.
Just on the rollout itself, the Shoppers Union wants retail workers given priority for vaccinations. Do you agree?
Well, I probably should declare an interest there, David. My son works for Woolies, and I'm concerned about the amount of contact that people on the front line, essential workers, have. But we haven't even had people in Category 1A vaccinated yet. There are aged care workers I met with this week in Redcliffe who've been unable to get vaccinated. We don't have disability care workers vaccinated. We don't have all our aged care residents vaccinated. We were told they would all be vaccinated by Easter. And what we've seen throughout this pandemic is that all of the targets that have been established have been missed, and so the government stopped giving targets. We were told that everyone would be vaccinated by October. Remember, that was Greg Hunt's advice last year, and now we're saying maybe they might get access to one vaccination by the end of the year. We need to do much better. The government's given up on targets. Now they're saying horizons, and we know that horizons are things that are never met. Just on the priority groups you mentioned, aged care workers will have to have a vaccine by mid-September, at least one jab. But disability care workers, National Cabinet's decided not to make it mandatory for them. Do you think they should? Look, I think essential workers who are dealing with vulnerable people in the community should be vaccinated. I think the issue here is, though, David, that they're unable to be. I haven't met. But when it's available, should it be mandatory? Should it be mandatory for disability care workers? I think it's a good idea if people who are dealing with vulnerable people are vaccinated. And just like in a range of other areas, like the flu vaccine for people working in aged care, there's lots of precedent for ensuring that there's protection, not just for the workers, but for the people that they're dealing with. But aged care workers, disability care workers, they're not in it for the money, David. They're in it because of their sense of compassion and the care that they have for those that they look after. And I'm very confident that were it possible, we would have seen people vaccinated by now.
Greater Sydney is now into its third week of this lockdown, staring down the barrel of a fourth and maybe further. Should JobKeeper be reinstated?
Well, if not JobKeeper, something very similar, David, because the key with wage subsidies was that it kept employees and employers together. So it was a good idea. We also need to look at businesses like hairdressers and others that have been forced to shut down. We also need to make sure when it comes to the vaccine rollout that we take it to people in those communities as well. These businesses do need support and workers need support. Workers are suffering, they're losing their jobs, and businesses are losing their profitability, and some are losing their capacity to be able to continue. I had a business owner in my electorate on the phone the other day in tears. He employs 20 people. He is desperately passionate about his business and he's worried that he's going to have to put people off. Now, this is a direct result of government inaction, the failure to vaccine enough people, the failure to have national quarantine facilities. So the federal government has a responsibility to step up here.
They are providing income support that up to $500 a week. It's in line with where JobKeeper finished before it was withdrawn. The difference, though, and you touched on it, is that JobKeeper had a link between the employer and the employee. So is that the part that's missing here that you would still like to see?
It is missing, David, and if the circumstances are the same as when that support was provided, then why isn't it being provided right now?
So bring back JobKeeper.
Well, I think if the government has another idea that would perform a similar function of keeping people in employment, then we'd certainly be prepared to look at that. We're not being prescriptive here. We are being constructive. We'll continue to be so, as we were during 2020. But the government can't just sit back and wipe its hands of responsibility in Scott Morrison's usual style. He has to accept responsibility here, and the federal government have to step up and work constructively with the New South Wales government to achieve outcomes.
Just a couple of other issues finally, and perhaps issues that go to the sort of Prime Minister you would be if given the chance. You mentioned aged care workers. They don't do it for the money. I think there's broad agreement they should be paid more. This was a clear recommendation of the Royal Commission. They're seeking a 25% pay rise right now. It's before the umpire. Should the government fund a 25% pay rise for aged care workers?
The government should be making a submission to the Fair Work Commission that they should be paid for work of their value, and that clearly requires a substantial increase in their salary.
Paid by the government?
Occurred with social well, it essentially flows through in terms of just as the social and community services award was changed in 2012 when we were in office. The fact is that feminised industries, those industries that employ women, are likely to be the most underpaid. And that's why we continue to have a 13% gender pay gap in this country. In 2021, we should be closing that gender pay gap, and we should also be respecting the hard work that aged care workers do. The Royal Commission has been very clear. There is a case before the Fair Work Commission at the moment, but at the moment the government's standing off as if it doesn't have a role. It should be making a constructive submission to it.
And a final one, you've also been highly critical of the government's commuter car park fund after that scathing report from the Auditor-General. I'm interested in the standard that you would follow on these things. Would you allow ministers to dish out grants for car parks, sporting clubs and so on? Or once politicians have set up a grant scheme, should they really be at arm's length from deciding how that pot of money is distributed?
Well, what you need is an appropriate advice that is at arm's length. We certainly did it when we were in office. The Regional Local Community Infrastructure Program did that. We used the Commonwealth Grants Commission formula, for example, to allocate money to each council around Australia. The problem here is, David, it's a $600 million scheme to fund 47 car parks, of which only 2 have actually been built, and some of the grants have gone for commuter car parks where there's no railway station here.
Yeah.
This isn't a park and ride scheme,
you wouldn't
it's a
have
park and ride
politicians.
scheme.
You wouldn't have politicians dishing out the money, though. Can you give us that commitment?
What we wouldn't have, in absence of any advice whatsoever, absolutely not. There's been no advice.
But after they get
here.
advice, they could still dish it out?
Well, with an integrity process there. And I'll tell you the other thing we'd do, David, we'd have an anti-corruption commission. I'll tell you what, if you had an anti-corruption commission with teeth, with independence, then you would be able to deal with the sort of rorts that have characterised this government. This government sees taxpayers' money as Liberal Party money, whether it's sports rorts, community safety rorts, the pork and ride scheme, or whether it be paying $30 million for a block of land that's worth $3 million around Badgerys Creek Airport. This government has established 21 separate slush funds in its last budget. It's a shocker, David, and it needs to stop. There needs to be appropriate processes that treat taxpayers' money with integrity, that have proper processes there for the allocation, not an electoral map that's colour-coded in the Prime Minister's office.
Opposition Leader Anthony Albanese, thanks for joining us this morning.
Thanks very much, David, and congratulations to Insiders on 20 years.
Thank you very much. We're going to turn to that a little later. And
go Ash.
Indeed. Well done, Ash Barty.